Hello and welcome to Ask SMP. I'm Danae, your community outreach specialist in Mississippi.
And I am Janetta, Complex Issues Specialist for the Senior Medicare Patrol program in Georgia, Louisiana, Mississippi, and Vermont.
Each month, we take a question from a beneficiary and break it down so you can learn how to protect, detect, and report Medicare fraud, errors, and abuse.
This month's question comes from Lou, who writes,
Much has been written about Medicare and Medicaid fraud and billing abuse, but there is never a clear definition as to what each entails. Most seniors like myself are likely not aware that there is a significant difference between the two. Could you please explain the difference and what beneficiaries need to do when confronted by either one?
That is such an important question, Lou, and honestly, a lot of people are in the same boat. The terms fraud and billing abuse get used almost interchangeably, but they're actually quite different. And understanding that difference can help you know what to look for and how seriously to take it.
Exactly. So let's start with billing abuse because it's actually much more common than outright fraud. Abuse refers to practices that result in unnecessary costs to Medicare or improper payments. But here's the key: without deliberate deception or criminal intent.
Right. Medicare has over 20 different payment systems. The billing rules are incredibly complicated, and healthcare providers deal with them every single day. So human error and confusion account for a huge share of the billions of improper payments every year. It drains taxpayer funds, but it's not necessarily malicious.
Now, there are some specific examples of billing abuse that are worth knowing. One common one is upcoding. That's when a provider bills for a more complex or expensive procedure than the one actually performed, just to get a higher reimbursement.
Another one is unbundling. That's when individual parts of a procedure are billed as separate services, which ends up costing more than if they were billed together as one combined procedure. Billing for unnecessary services or substandard care also falls into this category.
Now, and this is important, a simple billing mistake is not the same as abuse. A missing digit on a form, a misunderstood billing rule that gets promptly corrected, a legitimate treatment that didn't work out, those are just honest mistakes. Nobody's going to jail for a typo.
So that brings us to fraud, and this is where it gets more serious. Fraud involves deliberate actions to cheat the government and taxpayers out of money. It's a federal crime with real consequences, fines, imprisonment, and being kicked out of the Medicare program entirely.
Some examples: charging Medicare for appointments, equipment, or tests that a patient never actually received, changing dates of service, diagnoses, or medical records to make it look like something was medically necessary when it wasn't. That's fraud.
Identity theft is another big one. That's when someone uses your Medicare card or number without your knowledge to get medical care, prescriptions, or equipment. And then there are kickbacks. That's when money or gifts are exchanged for referring a patient to certain services or prescribing specific drugs. And that's illegal.
So what should beneficiaries do if they suspect either one? First, check your records. You can log into your Medicare.gov account to review your Medicare Summary Notice, your MSN, and verify that the services listed are ones you actually received.
And that's why SMP always encourages people to keep a simple medical journal or calendar. Jot down your doctor visits, prescriptions, any equipment you received. Compare that to your Medicare Summary Notice or your explanation of benefits.
If you spot something strange, start by contacting your provider to ask about it. If you're not satisfied, or if you feel uncomfortable, reach out to us. We can help you sort through what's an error and what might be something more serious.
You can call us at 1-877-272-8720 or visit www.stopmedicarefraud.org. As always, thanks for joining us on this episode of Ask SMP.
Stay alert, stay informed, protect your Medicare, and join us next time on Ask SMP.